today. I'm County Manager Dina DiOrio. I'm joined today by Gibby Harris, our Public Health Director, and our Medical Director, Meg Sullivan. I would also like to recognize Richard Hafner, who is our sign language interpreter today. I wanted to be part of today's COVID-19 media availability because we have reached a welcome milestone in our response to the pandemic. As you know, our policy group of decision makers has been meeting since March 2020 to coordinate the community response to COVID-19. The group includes leaders from public health, Mecklenburg County, emergency management, our 2 hospital systems, the City of Charlotte, the 6 towns, first responders, and other key leaders. We met 7 days a week for several months, then shifted to 3 times a week, and more recently, we have been meeting once a week. Today, I'm pleased to announce that the policy group has decided to wind down its collaboration and cease meeting on a regular basis. The data shows that the number of new cases, the positivity rate, hospitalization rate, and other key metrics continue to decline, and the work of this group is no longer necessary. The policy group did agree to continue tracking a series of metrics to include certain triggers that would necessitate bringing the group back together. Public Health is developing those metrics and triggers, and we will share those once they are finalized. I want to publicly thank the members of the policy group who have devoted so much time to this effort for the last 15 months. The time we spent responding to issues and making decisions protecting the community and limit confusion have facilitated helping the policy group work itself out of a job. In addition, the interaction among these agencies, both public and private, has helped us to get to know each other and build bonds and trust that I know will serve our community for many years to come. The policy group has indeed made this community stronger. In addition, I wanted this news conference to be in person at the Government Center today to highlight another sign that the pandemic is hopefully winding down. Next month, the Board of County Commissioners will return to the dais behind me for their first meeting in more than a year that will be in person and open to the public and the media. We are working with the city to determine the exact timing, but I am pleased that the days of virtual-only meetings are finally coming to an end. Finally, for more than a year, most county facilities have been closed to the public, and most county employees have worked remotely and provided county services virtually. Beginning in July, we will start to bring many employees back to the office and fully reopen our facilities to the public. We will provide an exact timeline of this effort when all the details are set. Again, I want to thank the policy group members for their dedicated service and commitment to the partnership. I look forward to continuing to build the relationship and collaboration we've established and leverage that momentum as Mecklenburg County recovers. And with that, I will now turn the podium over to Public Health Director Gibby Harris.
Good afternoon. As the manager mentioned, our metrics have shown incredible improvement over the last month. At this point, we are at 79 cases a day. That's an average over the past 7 days. Our case rate is right around 50 per 100,000. Hospitalizations are down to an average of 91 a day, and our positivity rate is at 3%, which is the lowest since we began tracking that metric. So the numbers are incredibly positive, and we want to continue to see them stay that way. In terms of vaccinations, we are partially vaccinated in Mecklenburg County at 45%. If we look at adults 18 and over, we're actually at 55%. For fully vaccinated, we're at 40% overall, and for adults 18 and over, we're at 50%. So again, our numbers in terms of vaccinations have improved and are continuing to improve, albeit a little slowly right now. We have seen improvements as well in our Latinx community and the percentage of that population being vaccinated. We still have work to do in our African American community in Mecklenburg County. So we are 15 months into this pandemic, and I want to recognize the collective work that it has taken to get us where we are today. The manager mentioned the policy group and the incredible work that they've done. I also want to recognize emergency management, who was not able to be with us here today, for all of the coordination and support that they have provided throughout our community around all sorts of issues. They've kept us all moving in the same direction to address the multiple needs of our community during this time. And while addressing COVID, they've also been addressing unrelated issues in our community that needed their attention. Their leadership and guidance has been critical throughout this entire pandemic. In addition to that, all of our first responders, whether law enforcement, fire departments, medic, have played many roles in how we've responded to this pandemic. Our healthcare systems have provided care as well as testing and vaccine in our communities. We've had multiple city, county, and town departments engaged and involved throughout, many nonprofits, our philanthropic organizations, faith-based organizations in our communities as well. There are many others. I know that I've not mentioned everyone that's been involved, but lastly, I want to thank and recognize the public health staff that have been involved in this. Countless hours providing services, support, education, and guidance in our community for the last 15 months. And they've done it all with grace and selflessness. All of these individuals, all of the people that have been engaged and involved are heroes in our community and should be recognized as such. They have made this a workable situation here in Mecklenburg County and allowed us to be where we are today. I don't want to throw water on the success that we're having at this point in time, but I do want to make sure that people understand that COVID is not gone in our community, and we need to continue to be careful in how we interact with others and how we go about our business in our community. We are changing and adjusting our work and our current situation in our community in terms of what the needs of the community are. And we need to make sure that we continue to recognize the almost 1,000 members of our community that have lost their lives to this virus in the past 15 months. Our heart continues to go out to the families who continue to grieve their loss. We are, however, coming on to a holiday weekend, and I wish for everyone to have a wonderful and safe weekend with their families and with their friends. We want you all to be able to enjoy yourselves, and we want you to be able to do that safely. The first way you can do that is to get vaccinated. It is the simplest, safest, and most effective way to protect yourselves and to protect others. Vaccines are readily available, and we need people to take advantage of that. But if you're not fully vaccinated, we need you to continue to wear your masks while you're in public, especially indoors, and to continue to socially distance and avoid large crowds. So again, hoping everyone has a wonderful holiday weekend and enjoys the good news that we have around COVID at this point in time in our community. But we also need you to be partners with us as we move forward to make sure that we completely get to the point where we don't have to worry about COVID anymore. With that, I'm going to turn it over to Dr. Meg Sullivan to talk more about vaccines.
Thank you, Gibby, and good afternoon, everyone. I am, as always, excited to be here today to provide a brief update regarding COVID vaccine for Mecklenburg County Public Health. To date, Mecklenburg County Public Health has provided nearly 145,000 first and second doses and continue to engage in significant collaboration with all of our vaccine providers in the community. As a few specific examples of this collaboration, we continue to provide vaccines in partnership with emergency management, medic, and our city, county, and town fire at both our medic location on Wilkinson Boulevard and through our homebound vaccination program, in which we've been able to provide over 550 total first and second doses to date. In addition, we collaborated with Charlotte-Mecklenburg Schools and 6 other vaccination providers last weekend to hold clinics at 7 CMS sites, during which over 1,000 vaccines were provided to adolescents, parents, staff, and community members. Mecklenburg County Public Health has also collaborated with numerous community partners, organizations, and providers to provide COVID vaccine at over 110 different sites in the county for a total of over 230 first and second dose clinics in the community setting, with a specific focus on prioritized zip codes, census tracts, and populations disproportionately impacted by COVID. This is in addition to the numerous events hosted by our other vaccine providers as well. We also continue to work through our hotline, trusted community leaders, and community partners such as Action NC to talk directly with unvaccinated individuals about their questions and concerns to ensure they have accurate information about the safety, effectiveness, and importance of the vaccine. Through this tremendous amount of hard work and partnership among vaccine providers and community partners, over 500,000 Mecklenburg County residents have received at least one dose of the vaccine, and over 441,000 are fully vaccinated. While all these numbers represent ongoing progress in our effort to vaccinate all eligible individuals as quickly and equitably as possible, we know we still have a lot of work to do to get these numbers even higher to prevent further spread of COVID in our community. As Gibby mentioned, we released data today that showed uptake of vaccine by zip code and by race and ethnicity. And while we have made significant progress, particularly in our Latinx community, the data continues to show ongoing disparities in vaccine uptake in our community, and we remain committed to our vaccine equity plan and efforts to ensure accurate information and access to the vaccine equitably throughout the community. And this equity focus is what continues to drive public health's efforts in vaccine response. Just wanted to take the time to note two exciting updates related to vaccines. First, earlier this week, Moderna announced very strong data from its clinical trials involving 12 to 17-year-olds that demonstrate the vaccine is safe and effective in this age group, and they plan to apply for authorization for this age group very soon, which is great news in our efforts to get everyone vaccinated. I also wanted to provide an update about the Summer Cash Card Incentive Program announced by the North Carolina Department of Health and Human Services Division last week. Next week, Mecklenburg County Public Health will join the pilot program and begin to offer $25 cash cards at specific locations and vaccine sites, clinics hosted by Mecklenburg County Public Health to individuals ages 18 and older receiving their first dose of the Pfizer or Moderna vaccine or the single-dose Johnson & Johnson vaccine, as well as to individuals driving someone to a vaccination site to receive their first dose. We anticipate being able to provide these cash cards as early as next Wednesday, June 2nd, and we'll update our website with the specific sites that will have the cash cards available as soon as we are able to confirm the start date with the state. We also expect to have continued updates and information on this initiative as the pilot continues. And I will just end by saying that we continue to see strong, indisputable data that the COVID vaccine is safe, effective, and is saving lives and allowing us to get back to doing the things we love. For those individuals ages 12 and older who are not yet vaccinated, we strongly encourage you to do so. And for everyone, please have a safe, enjoyable holiday weekend. Thank you.
First question today is Vanessa Rufus, WCNC.
Hi, good afternoon. Hope y'all can hear me. Okay, I will continue forward as if you can't hear me. I wanted to go back to the latest zip code data that came out. Seems clear to me that the so-called wedge of affluence is where the highest vaccine uptake is, and there's a pretty big disparity in the rates that we're seeing compared to what would be in the crescent that would be north of there. What are your remarks in response to that, seeing that disparity? And are there any, I guess, different strategies that y'all be considering in order to try to increase the uptake in those lagging communities?
Thanks for that question. Actually, we're not terribly surprised by that data. We knew that we were having some challenges with certain populations to get them vaccine and to help them be comfortable with their vaccinations. There are a number of different things that we're doing right now and have been doing for quite some time. Both hospital systems as well as the health department has been very engaged and involved in providing pop-up clinics and clinics at specific sites in those zip codes. We also now have a relationship with NC Action, who is helping, or Action NC, excuse me, who has individuals who are going door to door and actually getting information into the hands of people to encourage vaccinations. We'll continue that work as we move forward. A lot of the locations that Dr. Sullivan mentioned where we'll have the cash cards are in that area. So we are doing everything that we can at this point to encourage vaccinations and to make sure that they're readily available in those areas. So that work will continue, and if there are other ideas that the community has, we're listening to those as well.
Thank
Next
you.
question, Brett Jensen, WBT Radio.
Hey, Gibby. Curious. So on Monday, we had a chance to talk with Tom Glick of the Panthers, saying that they're going full 100% capacity, obviously, for any upcoming event, concerts, football games. And 30 of the 32 NFL teams are going 100% full capacity, no mask required either. What are your initial thoughts on that? Is that just a sign that we're basically back to normal, assuming we have the vaccine?
Well, there are several different things, I think. One is we are still strongly encouraging individuals who have not been fully vaccinated in settings like that to be wearing a mask. number one, to protect themselves, but to protect others as well. So that, well, they'll still be encouraged in conversations with the Panthers. Excuse me. They are going to be encouraging people who have not been fully vaccinated to wear their masks during those events. So we'll continue with that recommendation. At the same time, we'll continue to do everything we can to help people get vaccinated. And I know that there has been some effort between at least one of the hospital systems and the Truist Field to get some vaccinations out during games. We're having further conversation with them about ways to do that. So we're wanting to, again, either get vaccinated or wear your mask. Those are the things that we're recommending for everybody.
Next question, Allison Kuznets, Charlotte Observer.
Oh, can you hear me now?
You're good.
Okay. The governor has set out the goal that he wants 2/3 of county residents to be vaccinated. Does that still seem like a realistic goal? And if so, when would you expect Mecklenburg could reach that target? We're at 40% fully vaccinated right now.
The 2/3 was an amount that he put out about a month ago, I guess, and I think the state is still hoping that we can move towards that goal of 2/3 of our population being vaccinated at least. I think he had hoped for June 1, but I think now they're thinking July 4th. It's always possible that we will get there, and we are striving to get as many people vaccinated as we can. We want our community to understand that the vaccines are really what's going to help us continue to get out of this pandemic. And so we'll do everything we can to make those vaccines available and to encourage the community to get those.
Next question, Chloe Leschner, WCNC.
Hi there. We just surpassed the milestone in the state of 1 million cases of COVID. If you could just reflect on that a little bit, and then what we need to continue to do to make sure that the metrics continue in the same direction.
The numbers speak for themselves, I think. Over the past 15 months, we have seen this pandemic ravage many of our communities. And it has wreaked havoc, I think, in terms of people being ill, people dying. The good news is we are hoping at this point that we are on the other side of that. Our numbers are looking as good as they have since the beginning. And again, what we need to do is the things that are going to help prevent us from getting back to where we were. And those things, as we've always said, are vaccinations and masks. Those are the two main things we need people to remember. And if you're not vaccinated, we don't know what else to say. You just need to get vaccinated. If you're vaccinated, fully vaccinated, that gives you the opportunity to feel much freer in the community, to do the things that you want to do, and to not worry about becoming infected or infecting others. So we need as many people as possible getting vaccinated, and if you're not fully vaccinated, you need to wear a mask and socially distance.
Next question, Caroline Hicks, WBTV.
Hi, thank you for taking my question. When it comes to vaccine incentives, I know that you mentioned the $25 cash cards. What are you hoping that will do in terms of upping the demand? And are you surprised that this is what it's taking, incentives to get people to take a vaccine that in some countries people would be thrilled to have? Are you surprised that that's what it's coming to?
We know from the past that there has always been some level of vaccine hesitancy, and that getting people to take vaccines takes encouragement, takes education, takes information, and quite often takes hearing from people that they trust and people that can give them the information in a way that they can hear it. So we know that that's the case around vaccines in general. With this particular vaccine, there's been, concerns voiced from a lot of different sectors for a lot of different reasons. We have been working hard to combat those concerns and to help people understand the safety and the efficacy of the vaccine. At this point, because we know how important it is for people to be vaccinated, there have been lots of opportunities and lots of creative ideas across this country about how to incentivize people to be vaccinated. So the state offered us the opportunity to try the cash cards. This is a pilot. We're going to try those. We hope to see some positive uptake in vaccine because of those cash cards. Sometimes it just takes a little nudge for people to get over that line to go ahead and get the vaccine. So we'll see what this does, but we've got our fingers crossed at this point.
Floor is open for follow-up questions.
Dina, this is Brett. Can I ask something real quick, completely unrelated? Just wondering if in the last couple of weeks, or last couple of days, since your meeting on Tuesday, has CMS reached out to you directly or indirectly by any chance?
They have not.
That's really all I needed to ask. Thanks.
Mm-hmm.
Next question, please. Any further questions today? Last call for questions. Thank you, everybody.
Thank you. Have a great weekend.